put your hands together to welcome our first guest, Dr. David Dalton, President, Chairman, and CEO of Univec Conglomerate, Inc. He will be coming on stage, and again, he's going to share his valuable insights with us on the topic, Integrative Solutions for Modern Healthcare. Please give him a hand.
First of all, I'd like to thank you. I'd like to thank Justin from IFAH for all of his courtesies and attention to detail, because in every organization, you need an individual like that that dots the I's and crosses the T's. So I certainly appreciate that. My name is David Dalton. My credentials are, I'm in 3 halls of fame: Senatorial Medal of Freedom, Top 100 IFAH Visionary, Top 100 Black Enterprise. I am a black man from Grafton, West Virginia, and if you haven't heard of Grafton, West Virginia, that's where Mother's Day began. I'm also CEO, chairman of a public company by the name of Univec Conglomerate. UNVC is the symbol, and its purpose is to make a lot of people wealthy, as well as address some of the healthcare disparities that exist in the United States. What I'm going to talk about is integrative solutions for modern healthcare. But I think to do that, we have to know where we came from and hopefully, based on that historic information, where we're going. Back in 1970s, so I want to age myself, I was executive vice president of a company called Rite Aid Pharmacies. And we were the fastest growing pharmacy chain in the United States. And in that growth, pharmacists used to fill prescriptions way back then, even using a Remington typewriter, if you could recall those days. In line with that, there was a transition of reimbursement on pharmaceuticals going from cash and carry to what you refer to as third-party pay or paper. So we had a transition where cash and carry in the operations was moving from 95% all the way down to less than 30%. Presented a problem for us. Every insurance company at that time had a different insurance form for every insurance company. First problem we had to do is we had to come up with a universal claim form, still piece of paper, that pharmacists and pharmacy technicians had to complete in order for processing and getting reimbursed for prescriptions dispensed. We then went from a claim form that every insurance company had to what we called a universal claim form. And that was because we had to get together, we being the chain industry, about 4 people, collaborated in such a way that from an administrative process, we had to find a solution. So at that time, myself with Rite Aid, Revco, 2 insurance companies, Travelers, and Metropolitan Life Insurance got together and said, we're going to have a universal claim form so that all the pharmacies, both chain and independent, do not have to use the 10 forms for every different insurance company. We founded what is called today the National Council of Prescription Drug Programs, headed up by a very dynamic executive by the name of Leanne Stemper. The universal claim form also transitioned to the universal tape format. The universal tape format transitioned into online real-time adjudication from the pharmacies to your insurance company to a physician database so that you can have real-time information to fill a prescription. Now I'm talking about back in the 1970s. I'm not talking about today. That's a platform as to where the profession of pharmacy had to come from to be able to administer correctly and monitor the patient in the delivery of pharmaceutical health care. In that transition, we then said, okay, the data that's coming out of that started to tell the pharmacy and the professionals that there's misappropriate prescribing for different populations. Inappropriate prescribing meaning that the doctor was writing a medication that was not appropriate, for example, minority Black communities for hypertension. So at that time I founded, this is back in 1988, the National Minority Health Association. And we founded that because there was not a minority office of healthcare in any of the states. So our goal was to get focused an office of minority health in every state in the United States, which we got accomplished. Things were going well, and then something called COVID-19 came around. And at that point in time, the trust of the vaccine, the access to the vaccine was and still continues to be a problem. So vehicles and pathways to get the vaccine into minority communities through how we were integrating the healthcare system was not easy because, in my opinion, it was made political. So you had the states making purchases of the vaccine directly from the federal government, and it was not being distributed effectively within the communities. It was not until the pharmacies who contracted directly with the federal government that did not have to go through the state bureaucracy and politics could get shots in the arms in the minority communities that needed it most. So when you see the pathway of, in our healthcare system, politics continue to affect the delivery system, beware that if in fact the state is totally in charge and you do not have oversight, you may have populations of people that do not have access to the appropriate health care, so therefore it's not integrated. It's exclusive within hospitals and then mass vaccination locations. Then the best way ever for distribution of anything is going to be in our local community pharmacies that's in every community throughout the United States. So that's where we had, that's how we resolved it. And then it came to the actual cost and reimbursement, because there's some populations that could not afford. Thank goodness the COVID-19 shot is free. Everyone should trust it and move to as efficiently as possible to get their shot. In all of this, the same thing exists in Univec Conglomerate, symbol UNVC. We have continued to work to give a platform for those people that are further disadvantaged, i.e., the drug addict, the drug, let's say, challenged, the prisoner offender returning to the community. They have to have a pathway in order for them to regain their life. So if there is a substance misuse problem or a mental health problem, Univec has clinics that addresses those situations, and most services are free of charge, meaning that the patient can get access to a benefit. That benefit is through the state Medicaid or the state Medicare. And most people do not realize that over 66% of the reimbursement in healthcare in the United States is by Medicaid which is a state-run program, and Medicare, which is a federal-run insurance-type program. When you look at this and you think there's still barriers to health care, you wonder why. So we have our clinics where we have the mental health support, the substance misuse support, but you cannot address just one item that addresses the challenges of healthcare in the United States. We believe that you have to have a total wraparound program. So our patients that's in our clinics, we will also provide to them temporary housing. If they're coming out of prison, they do not have homes. A lot of them do not have any place or anyone to rely or depend on in order to make that transition. The chemically challenged individual that may be on the street needs guidance, support, and they need to trust the system in order to put them into an environment that they can get back on their feet. So we transition our patients from the street, from the prisons, into our temporary housing. Temporary housing is free of charge. We provide the services, that's how we make the revenue. Giving back to the community is by giving free temporary homes. While they are in the homes, there's obligations that we expect them to perform. One of those will be focused first, and they have to agree to it, is financial education. If you have a challenge of the actual addiction and the actual mental health challenges, you also have to have financial education. And in this country, when we look at our financial education platforms, there is a lot to be had. If you come from an impoverished community, they do not teach financial education in the schools. My son-in-law runs a nonprofit called Operation Hope. Throughout the United States, their one focus through Operation Hope is to have financial education for individuals that do not even know how to operate and own a checking account. That support is a significant support system because the banks have not looked at that until recently as to give that support. When the patient goes from the temporary housing, they go into our financial education platforms. Other agencies and partners that we have is like Legacy Education. That system also supports individuals not only in financial education, but in basic education. So when you have off the street into a system, healthcare support, temporary housing to permanent housing, when you have the temporary housing and you transition into permanent housing, to be able to buy a home in the United States is a real challenge for certain populations. So there is a company that we partner with that, by the way, one of the owners is the owner of the Atlanta Hawks, which is in the playoff. Everybody should check that out tomorrow night. So Wrestler and Aries Capital and my son-in-law, under Promise Homes, provides permanent housing. So you got the whole wraparound system that you support, from a prison or the street into the mental health substance abuse support system, financial education, temporary homes, permanent housing, into actual job and or business creation. A company by the name of Spotify is supporting businesses so that individuals now have the opportunity to start their own business. Check that out, it's a good platform. So when we look at healthcare today and the integrated systems that have existed, historically they have existed from a technology perspective, that will continue. The process of making sure that you're in front of the wave is to make sure that you have control over what that technology is going to be for the platform that you want to serve. Univec's telehealth platform, we used to partner with the company by the name of Teledoc. Teledoc platform is not specific to the platform that we needed. So therefore, we started our own platform so that we can meet the patient where they are. In telehealth, you cannot give individuals a complicated process in order to access the healthcare system, in order to talk to a physician, in order to talk to a psychiatrist. It should be a simple thing as to opening your phone, hitting the button, and speaking to that professional. Then you say to yourself, where do they get the phones? Univec gives them the phone, free of charge, to make sure that they always have a way to communicate with their healthcare provider, specifically their doctor. Let me tell you how some of these programs have worked. We're going to talk about our asthma program that we did in Ward 7. As an example, 3 o'clock in the morning, child has an asthma attack. Parent calls our Univec telehealth, speak to a doctor. The doctor does an examination, peripheral, and verifies that it is in fact an asthma attack. The child does not have an asthma inhaler, or if they have one, it may even be out of date or empty. Physician sends that prescription online to one of our pharmacies that will deliver that medication to the child's home within an hour. The child receives the medication supervised by the mother or father, and making sure online with the pharmacist that they know how to administer the inhaler. Within a half hour, if the child does not receive relief, the parent has the option of taking that child directly to the emergency room, or if the child has relief, we will send a physician to the child's home at 8 o'clock the next morning. That's a total wraparound system where you meet the patient where they are. We have the same type of programs in cardiac support. Cardiac support pre-COVID, in order for you to have cardio rehab, the rehab had to be done in the hospital, which means that certain populations of people had barriers of getting to that hospital because they may not have a ride. Now those situations have turned so that cardio rehab can be done in the home. Univec provides the devices to be able to do what needs to be done through the telehealth platform for cardio, and at the same time we monitor the actual details and symptoms of the outcomes of what the cardiologist has prescribed for that patient. So in line with our telehealth programs, we address the mental health, cardio, diabetes, and asthma as our 4 primary support systems, but we also tie it into products. The cannabis CBD platform, we have done studies with the University of Maryland and BioRemedies to make sure that what is being put out there is in fact the most efficacious cannabinoid, CBD, THC, that in fact can address some of the problems as it relates to pain management. The other products that we have is vitamin D, lidocaine, and a lot of these delivery systems are on our delivery systems that's looking at the transdermal delivery pathway. A lot of medication today is a problem in how people take it. A lot of adherence problems with taking the medication, and we believe that the transdermal pathway is the pathway to go. We partner with companies such as Amazon, just to name a small one. And in that light, Amazon looks at things in a different way, but they still need to be educated from the standpoint of how, in fact, reimbursement is made. Amazon will be making an announcement that they will provide 6 months of medication to the patient delivered through their systems to their home. Well, that's all well and good, but if your insurance company is only reimbursing for 90 days, then it's got to be modified to the reimbursement of that payer. Otherwise, the program is going to stumble. So in that, I would leave with you the following facts. In this room, we have a group of dynamic, intelligent individuals that can deliver health care in a different way every day. You know what your platforms are. Do not let the bureaucratic, pontificating systems tell you it won't work. I had a talk just earlier with a gentleman that provided services within the hospital. The frustration was the services are great, they work, but you have this dinosaur mentality that's in upper management. Don't get frustrated with that. I promise you it will change. We're in a new era of healthcare. The services that you provide are going to be the services needed. Some of these dinosaurs are still in healthcare that don't think it will happen. They will end up being on the board of some of these companies that we used to know, like Kodak as an example, and you'll see that they will go to the wayside. This new generation of professionals to deliver health care through an integrated platform is the way of the future. My advice to you is that I have fought those systems. I know how those systems work. Univec Conglomerate is going to make a change to all of those systems. So you just get on board and you do what you need to do to make sure that those systems change. They change for the better, for the patient care, because technology today can provide a lot of platforms to make it better. With that, I thank you for listening, and everyone have a great day.